I'm Lieutenant Colonel Nicholette Dennis. I'm a social worker assigned to the UAMTF number 5, Fort Gillem, Georgia. My experience as a behavioral health provider at Elmhurst Hospital have been extremely rewarding. It's been my privilege to be here and to be part of the effort to bring families together during such a time as this. We have the honor of connecting patients and their family members during their hospital stay, and what better gift to give than to allow a patient and a family member to share virtual space and time when face-to-face visits are not allowed. We're here to provide stability, to provide morale, encouragement, a good ear, when somebody just needs to take a deep breath. We help them with stress management. I've been able to help some folks through some breathing exercises so that they can refocus and become grounded. Stress is normal. Everybody experiences stress. It's just how we react to it that makes a difference. And so if you're able to realize that stress is going to happen, it's going to occur, and you have some tools to be able to address it and cope with it, and you understand the warning signs, you know the signs and symptoms of stress, and then you know how to combat it. You know exactly what you need to do to de-stress. Stress doesn't always have to be negative. You can have positive stress. Stress can be something that kind of motivates you and prods you and encourages you and maybe pushes you to do things that you didn't think that you had the ability to do, such as being able to be a part of a mission such as this. I can't imagine not having this program in place. If this program was not in place, then the families would have to experience this by themselves, and that simply is unbearable. To be in a crisis situation and not have the ability to have your support system with you is just unthinkable. The worst thing you could do is not take any action whatsoever. So even if you have to write it down, I would advise someone to journal, and then take it one step at a time. If journaling is not something that works for you, then perhaps confiding in a trusted family member or a friend. Picking up the telephone can sometimes be a great source of stress relief because you have the ability to be kind of anonymous, but at the same time, you're still getting the help that you need. So there's lots of 1-800 numbers available out there. We have a 1-800 number for our soldiers and for our vets. And so if you're in crisis, what's important is that you do get help and you push yourself forward so that you can line up in the direction you want to be. I'm fortunate in that I have a great support system at home. I have a loving family. I also have a great command team, so if I needed to vent or to talk to them about anything that was, caused me any type of conflict, then I would have a source to speak to. I have a great team, and I'm able to, talk things out, and we debrief each other. Anything that's of a concern, I like to, address it right away and figure out why this is impacting me and what I need to do to self-care. I make sure that I have self-care tools in place. I have a pretty big tool bag, so I know exactly what works for me. Stress management is huge. Being able to just talk about it sometimes is important. What I've noticed during this mission is a strong sense of community. I'm inspired by the support from the family, the hospital staff, fellow soldiers, and of course our command team. We're all in this together, and it's obvious here at Elmhurst Hospital.